But the sweetest of all that I can recall is Tootsie, Tootsie, Tootsie Roll, da-da-da. Yeah, my uncle wrote that and I sang it on the stage.
Come on.
At some point during the course of dementia, you will be faced with one or more of the following questions.
Let's say your heart stopped.
Oh.
Would you want us to shock it to restart it?
I never gave it a thought. I never died before.
Would your loved one want to be resuscitated if their heart stopped?
If you got pneumonia here at home, would you want to be put in the hospital to try to make you better?
If they were very ill, would they want to be hospitalized? Would they want to be treated with antibiotics for infections?
Would you want a feeding tube to keep
I think, Dr. Hamilton, I wouldn't want...
Would they want to be kept alive with a feeding tube when they can no longer swallow?
You weren't going to really recover, and I wouldn't want it.
So us having discussed that and her giving me those directives, then it made it a lot easier towards the end. It made it easier for the rest of the family, too.
It is a true gift to families when medical and family caregivers can talk with the patient about these decisions early and learn what the patient wants for the future.
That last day when the paramedics came, it was very hard, and we had to rely on each other and remind each other in that moment. So even with the directives, in that final moment when it's time to make the decision, it's incredibly difficult. So I can't even begin to imagine what it's like for families that don't prepare before something like that happens.
Let's say you got Alzheimer's and it was not good and you didn't know for sure where you were.
If we learn about dementia in time, we can ask our loved one what they want for the future.
All of our jobs, I think, is to say, what would she ask for if she could tell us, because she can't.
If it is too late for our loved one to guide us, then we must make decisions as best we can.
My thinking is that if there were something that happened...
Our job is to make decisions based on what we believe our loved one would want, knowing that dementia is a terminal illness. There will be no recovery. And that the medical conditions that might arise, heart attack, stroke, infections, will require a choice between treatment or comfort care.
But I wouldn't want to prolong things where he's uncomfortable. I'd hate to see him in an uncomfortable situation, sitting in a hospital bed or hooked up to, or even at home, real uncomfortable.
And not able to understand what's going on.
Yeah, just miserable in that. I don't think any of us want to see that at all.
We don't like the ventilator in the ICU, and if we have to go down that road, if we end up with the ventilator, we don't want her to die in the hospital, do we?
Then don't hospitalize her and don't do CPR.
I mean, we just don't want that. It would be the worst way for her to go.
Yeah.
We would like her to remain here
at home.
And if that's just truly not possible, then the inpatient hospice is preferable.
Now, this is the form we use in our office. And we use it because living wills are not very helpful.
Okay.
Because what living wills say is, if I'm in a terminal condition, I don't want these things done.
Oh, she doesn't.
But, for instance, if you have a heart attack, you're not necessarily in a terminal condition. So if the first question here is, do I want CPR? That's when you put you on a breathing machine and shock your heart to restart it. If you say no to this, that means under no circumstances do I want that terminal condition or not. And that's clearer for a doctor.
We have all these discussions.
Do you have an orange form filled out on that?
I'm sure we have. My sister took care of everything with that.
Because, if the paramedics get called,
yeah,
they'll do everything unless you have an orange form sitting
in the house. No, we don't.
They would intubate her, and they would shock her heart, and they would do everything unless you show them this.
Okay.
Swallow, babe. Try real hard. You can do it.
The usual cause of death in dementia is infection, most commonly pneumonia. People with dementia lose the ability to swallow properly, often with pneumonia as a result. An important decision, then, is whether to treat infections with antibiotics or whether to allow the infection to run its natural course while keeping the person comfortable.
What's my name?
Except I probably have green in my teeth.
Although Jean has been routinely treated for recurring infections over the past 5 years, her daughter now believes it is time to stop.
I don't know what her mental process is. And I don't know if she thinks about anything or if she's just in another world. I don't know if there's a mental process there. I know that Jean would want to let go.
Chew and swallow. Try real hard now. You can do it.
The average situation with her would be multiple episodes of pneumonia. Then you could decide to try some antibiotics and see if it pulls her through it, or some families say, let's not do the antibiotics, let's just keep her comfortable.
Mm-hmm.
But there are people like her who never get pneumonia. It's not inevitable. What is inevitable is that she will, over time, not be able to swallow enough to retain her body weight if something doesn't happen first, if she doesn't get pneumonia first. And so at some point she will just get weaker and weaker, and then she gets dehydrated, and then she develops renal failure, and that's a very comfortable way to die. Then she just basically goes to sleep.
The days are so different. They're unpredictable. One day last week, she ate everything I could get to her mouth. No problem with any choking. And the other days, she chokes on everything I put in her mouth.
It is at this stage of the illness that many families and many medical professionals want to surgically implant a feeding tube in the stomach to begin artificial feeding. Yes, it may keep our loved one alive longer, but is prolonging life what they would want?
If her quality of life is bad enough to need a feeding tube, what kind of quality of life are you trying to preserve by giving her the feeding tube? I put a lot of stock in that analysis. I think I would say, it wouldn't be a life that Pam felt was
worth living.
Really great to preserve.
Most geriatricians, and I'm one of them, do not believe in placing feeding tubes for people who have a degenerative disease like Alzheimer's, because she will never recover. And because most of us, I don't know, is there anybody looking at that film who would say, I want to be kept alive like that?
No, never. No.
Any of you?
No.
Not one who has any feelings that they would like to be like her?
No.
Towards the end, I was having problems with doctors who wanted to save Mom's life. She was 88. And I called Alzheimer's Association, and they recommended a doctor that was focused on the quality of life and the dignity for the person involved. And I was forever grateful, because her prior doctor had insisted that she get a mammogram and a pap smear and all of these things that it was prohibitive, transporting Mom, etc. So I wished that I would have done that earlier.
This one is whether she would want a feeding tube if she...
As a professional or a family caregiver, please take the time now to ask, is there a point at which this person would not want to be kept alive by resuscitation, hospitalization, antibiotics, or a feeding tube? And then note this in a written form that is readily accessible. For help with these decisions and advanced directive forms, contact the Dementia Program of Hospice of the Valley today.